Hello and welcome to the fourth episode of the Public Health Link on Sunday, October 2nd, 2022. I'm your host, Marisa Salisbury. So it's hard to believe that we have now been doing this public health webcast for a month. I've received some fantastic feedback about how people are excited about having a webcast that's in the format of public health information. And as usual, I'm excited about tonight's information too. But before I get started, I just want to remind you to hit that subscribe button. By subscribing to the Public Health Link channel, that allows you to get alerts of any special reports we do during the week, as well as when our episodes are released on Sunday evening. So tonight's information for our action agenda, we're going to talk about damage from Hurricane Ian. We're also going to discuss outbreak investigation of foodborne illness and how you can find out any outbreak investigations that are currently happening. And we're going to discuss the public health alert on fentanyl that looks like candy. In addition, we're going to discuss the Tech Corner about a program that is currently helping those with rare genetic disorder, specifically in infants. And we're going to discuss a public health event. We're going to talk about two of them for tonight. And we can't forget the public health meter. So let's not wait any longer. Let's talk community action. Welcome to the action agenda for tonight's on the fourth episode of the Public Health Link. We have a lot of information to cover, and to be honest, the information I'm going to provide to you, I could have done entirely separate special reports because there's so much information. So I highly recommend that after you review this episode, don't forget to pull up the links and resources that are at the end and in the description of this webcast. I would love for you to take this information, talk about it with other people, discuss it with your household members, community members. Maybe you know someone, for instance, who was involved in the Hurricane Ian, either that lives in an area that was affected or is part of the first responders. And as an example, that you could provide this information to them that may be affected. So please don't hesitate to also share any information provided. So the three action agenda items that we're going to discuss tonight are damage from Hurricane Ian, as well as outbreak investigation of foodborne disease, and a public health alert that involves street drugs looking like candy. So in regards to Hurricane Ian, as of Saturday evening, it has turned to a post-tropical cyclone Ian. It's traveled up the eastern seaboard from Florida to Virginia, and it's wreaking horrendous havoc along the way. The count as of now, as of Sunday, has been more than 70 people have died, and it's expected that number is going to continue to rise. Hundreds of thousands are without power, and estimates include billions of dollars in damage. So as people return to their homes, there's some important information that we need to make sure that we're getting out to people to reduce the likelihood of disease, such as staying out of floodwater as best as possible. Be aware of down power lines. Unrefrigerated food is not safe, and even those that's in the cupboards may not be safe depending on if you've had water damage. And in areas of saturated homes can continue to mold and bacteria that could be harmful during cleanup. So it's very important that you've evacuated, or even if you were home, if you stayed during the hurricane, and now you're to the point that you're trying to regroup and put things back together. There's still a lot of health dangers that can result that you really need to watch for so you can continue to keep yourself and your household safe from this point forward. So floodwater can include chemicals, it can include bacteria, it can have human and livestock waste in it, and household and medical waste, not to mention animals themselves, wild and domestic. So it's very important that you're very careful with how you go about cleaning up after this. The CDC warns, and this is a quote, the exposure to contaminated floodwater can cause wound infections, skin rashes, gastrointestinal diseases, tetanus, and leptospirosis. So if you have to enter floodwater, if there's no way to avoid it, you're having to either leave your home or you're having to come back that there's some water still present, make sure you're using some form of personal protective equipment. So what am I talking about? I'm talking about wearing rubber boots, rubber gloves, and goggles. There are some instances where non-governmental organizations or nonprofits will have those supplies available to you in those areas. So if you're unsure, reach out to your local FEMA office, reach out to your local health department. They may be able to connect you if you don't have those items available, so that you're not unnecessarily exposing yourself to any of those chemicals and bacteria and any of those things that could make you ill. Not a good idea if you can avoid it. This infographic is perfect. That really shows, and this is from the CDC here. So it says, be ready hurricanes. And there's actually, the infographic, as you can see, is split between a before and after. So on the left-hand side, we're seeing, okay, this is what we do to be ready for it, right? On the one side of it, we're seeing, you're covering your windows, storm shutters, you're tuning in for local information. Now, by this point, we're past that, obviously, with Ian. However, I recommend for you to revisit that at a later time so that you can see, is there some way that I can change a little bit with how I'm prepared if I have to go through this again. The after, as you can see, talks about how if your home is damaged, do not re-enter till it's been examined by a building inspector for safety. It may look like it's solid, but depending on if there's been any foundational damage, or maybe there's a downed power line, you can't even see. It would be a very good idea to have someone inspect first. Prevent mold growth by airing out rooms and disinfecting. And actually, you can click on those links. It'll provide you more information about how to do that. Tap water may not be safe to drink, so watch for local warnings. Watch for boil orders, so you need to be aware if it's safe to drink the water. If not, of course, buy bottled. Throw away any food. It is not going to be safe in the fridge, and most likely it's not going to be safe in any covered situation, especially if you have water in your home. And if you're using the generator, make sure you're at least 20 feet away from the structure, as you can see here, because what we want to prevent is carbon monoxide poisoning. And in the bottom here, beware, of course, of any flood water that may be in a basement portion of your home. So it's very important that you've made it through the hurricane, you're trying to get everything back together, that you're very aware of other ways that you could become ill, and that you're able to protect your family and your friends. There's a lot of links in the resources. So in the video, the end of the video, as well as the description of this webcast, don't forget to take a look so you can find other ways to keep you and your loved ones safe. So there's been quite a few foodborne illness investigations, and I'm going to mention one of them tonight, but I'm also going to talk to you and show you how to actually look them up for yourself. So this is something you can continue to do. So most foodborne disease is a result of not prepping or preparing food in the safest way possible. So for example, you might be using canning. You need to use canning methods to discourage botulism. You're not using the same cutting board for chicken as you are vegetables. And, heating meat to the proper temperatures. Those are all things, because bacteria may be naturally present with that meat, for instance. So those processes remove that bacteria from the meat. So heating it, for example, removes the bacteria, kills it, so that you're ingesting it and in turn getting ill. So it's important that you're prepping and that you're cooking exactly how you need to, so that you're not getting ill from what you're fixing. So most pathogens that are zoonotic, so there's anything that's disease caused and it can be transmitted from an animal to a person, dies during the heating process. So that's why it's important you follow these. And I want to show you, this is a website that's through the USDA that actually reports any investigations they're doing on a federal level. Now, you can also check out your local health department. Some health departments do post information as well, but this is a good place to start, especially with the larger investigations that are going over state lines. So this explains, what the meaning of a public health advisory, for example. So it explains here that a public health advisory will be issued for investigations that resulted in specific actionable steps for consumers to take to protect themselves. So just like the public health link, the point is that hopefully we're putting what we're hearing in some form of action. Even if we're talking about other people, this is an actionable way to keep your family safe by being able to look up these investigations. So if I go down to the lower part of the page, I can actually see that there's a couple current investigations, or I should say recent investigations, that are being looked into. One has to do with salmonella and the other is listeria. And the total case count, so those are, when you see case count, means it's been confirmed. is 28 for the salmonella infection. The outbreak is active and traceback's initiated. So traceback is discussing some form of contact tracing is occurring. And the one I'm going to discuss with you tonight is the one that's Brie and Camembert cheese outbreak that's currently occurring. So if I was to click on that, that takes me to this page. So this is the actual investigation, and they will provide all information that they can. So in this case, this was manufactured, and I can see here. And I'm going to highlight this so you can see it. So this is a multi-state outbreak of Listeria, and it gives the actual technical name Listeria, linked to Brie and Camembert soft cheese, manufactured by Old Europe Cheese Inc. of Benton Harbor, Michigan. Okay, so this will actually tell me where the investigation is occurring. If I go further down, I can see how many cases or which states have been affected. It'll tell me the case counts in those states and what name that product may be sold under. Very important, because it's very common for products to be sold under multiple names, especially when you talk about going into different areas in the United States. So this provides you with all the information to try to stay on top of any recalls that may be happening, food safety recalls, so that when you see them, you know what to act. Do you need to take them, out of your pantry or out of your fridge, so that those like yourself or those in your household do not get ill? Now, I also want to tell you that for information and reporting, you can report, like if, let's say, you're either wondering if you're one of those cases or you're concerned about another potential food source that may have made you sick, you can actually report it to CDC. It's 1-800-CDC-INFO. That's 1-800-232-4636. And they're available Monday through Friday, 8 a.m. to 8 p.m. Eastern Standard Time, and they're closed federal holidays. So that's another good place that you can either ask them, like I could call them and ask them about this outbreak, or I could potentially report that I might be sick from it, or I have concerns about a food that I've eaten, questions about. They can't provide you medical advice. You would need to see your own doctor for that. Or if it's emergent, go in the emergency room. But they can at least direct you on ways to report it. In the state of Michigan, we can also report any concerns through the Michigan Department of Agriculture and Rural Development, or what we call MDARD. And I wanted to show this too, because you might, in your own state, it could be a health department, it could be a Department of Agriculture that could assist you in addition to the CDC with any concerns of foodborne disease. So in this case with MDARD, or the Michigan Department of Agriculture and Rural Development, I have a phone number here that I can call or I can email. In addition, they provide some really important information. I really wanted to point this out to you. So they explain that if you suspect a foodborne illness, please seek medical attention, of course, and save any leftover food and packaging for them to see. This can be important not only for the fact that they may be able to test that food, but also for tracking purposes. Keep in mind, like I mentioned, that you can have a product that's under multiple names. And think about today how you can buy food, like there's many food order companies where you can get food from all over, I'd say all over the world, not just the country. So keeping that is a very valuable piece of information when they're trying to track a potential foodborne illness. And it's really important because it could help save other people's lives, or at least prevent them from getting ill. If they know about it, they can pull that food off their shelf. So this is an important action item, is that by knowing how to track foodborne illness, you keep yourself safe, and you know of a way to report it just in case you're somebody that suspects or is concerned about a foodborne illness. And then for our last item of the evening, this one was very concerning to me, and I definitely think, especially, I'd say with Halloween coming up, but this is not really a Halloween issue. This is a period issue that we need to be aware of. So I read this article that the concern is this fentanyl, and this is actually a picture of the fentanyl they're referring to. Looks like rainbow, and they comment about it looking like sweet tarts, and that is actually straight fentanyl that you're seeing in that picture. So the concern is who may have it, and of course, if you're doing these kind of colors, you're not trying to appeal to adults, right? You're trying to make it look like candy. So according to the Center for Disease Control and Prevention, or the CDC, 15% of high school students reported either having used select illicit or injection drugs like cocaine, inhalants, and heroin, methamphetamines or meth, hallucinogens or ecstasy. 15%. Now, I would say off the cuff, if that's the ones that are reporting it, that number is probably higher, is what I would estimate. 14% of students reported misusing prescription opioids. So when I see something like this, my actionable item is how to identify drug use in those that this looks like it's trying to target, which is kids, right? So and again, the links will be in the webcast for you to look for yourself. The Hazelden Betty Ford website gives fantastic breakdown of what signs you may be looking for. So that could indicate teen drug abuse. Anything from acting irresponsibly, ignoring or breaking curfew, missing school or work, resisting discipline or feedback. Now, there's some of this may be teenager. That's why I'm saying for you to read it for yourself so that you can see what may be normal and what may not be for your teenager, something that may stand out. They have additional resources you can seek, ways of how to approach the teenager you're talking about for additional questions and engagement. In addition, the Substance Abuse and Mental Health Services Administration has this 1-800-662-HELP. So if you have questions, reach out to them because they can help you guide what you can do for your family. So thank you so much for joining me on tonight's action agenda. Hello and welcome to the Tech Corner for this 4th episode of the Public Health Link. You know, the more that I do the Tech Corner, I get so excited and realizing how some of the equipment we have in our home is actually being used now for some pretty awesome disease prevention types of tools. Tonight's is going to include the use of a 3D printer. But the more I read that uses 3D printers, it uses virtual reality, it makes me even more excited to pass that information on to you. And don't forget to look up at the end of this, at the end of the webcast, as well as in the description of the webcast, resources so you can look it up for yourself. I highly recommend for you to do so. So as you can see, what we're going to talk about is a 3D organoid model identifies potential treatment targets for devastating pediatric kidney disease. So the National Institute of Diabetes and Digestive and Kidney Diseases states it's a disease called autosomal recessive polycystic kidney disease, or ARPKD, also referred to as infantile polycystic kidney disease, is a rare genetic disorder that affects approximately 1 in 20,000 births. So a fetus or baby with the ARPKD, the autosomal recessive polycystic kidney disease, has fluid-filled kidney cysts that may make the kidneys too big or enlarged. ARPKD can cause a child to have poor kidney function even in the womb. So this study that this is referencing here was led by Ken Hiratsuka and Raju Marizan. And if either one of you are watching this and I just devastated your names, I am incredibly sorry about that. And I highly recommend the names are right here because I definitely want to make sure I'm giving credit to the people doing the work. So those are the two researchers that led this research, and they attempted to develop treatment, which there currently is none for, through the usage of a 3D printer. Why is this so important? Well, this particular disorder is characterized by the formation of cysts in the kidneys, right? So, which enlarges the organs and causes a progressive loss of kidney function. So, when I want to show you, one of the things they point out in this article is how different this disease can make a kidney look from one infant to another, which has posed some concerns of how do you treat this? Because if you're trying to do anything about what it's actually doing to the kidneys, you need to have an idea of what it's doing to the kidneys. And keep in mind, these are infants. These are CT scans as well as MRI scans. And all I want you to see here is how different one looks to another. So this is not a situation where some diseases we can go, oh, look at pneumonia is very profuse. This is how we typically see it according to Loeb and so on. You can specifically point out. One of the concerns they point out with this in the article I just showed you, again, the link will be posted at the end, is that this disease makes it very difficult to say this is how it typically affects each patient. By having a 3D printer, it allows them for that organ to be tangible. So it allows them to take measurements from a CT MRI scan and actually see how to treat that particular infant. I just thought it was incredibly intriguing, especially when you look at like all these images here and see how different it can look from one patient to another, right? So for those patients who survive, because this can be a fatal disease, has been reported the mortality rate can be as high as 30%. For those patients who survive, 41% will require a kidney transplant by the age of 11. This is one of those diseases that, even though it doesn't affect a tremendous amount of children, so we're talking 1 in 20,000, right? It's devastating. It's something that either is high mortality rate, or you're talking about something that can be debilitating. So it's very important to catch this and treat this as soon as possible, as soon as you can identify it. So essentially, ARPKD can present different for each patient. The 3D printer allows a researcher to see how that organ is being affected. But these researchers were also able to use the printer and actually look at two different modalities for treatment modalities, and were able to test them on top of it. So not only did they test a way to further diagnose or get a better idea of severity of this illness, right? But they were also able to show it in use and look at two forms of treatment and test those forms of treatment. Because as I said, currently there is no FDA-approved treatment for this disease. What is looked at this point is that it's going to require organ transplant. So the use of a 3D printer being able to not only save the life of an infant, but potentially provide treatment that wasn't available prior, this is pretty interesting. And it's a 3D printer. I mean, my mind went to instantly how I can buy those now online. I can go into a store and buy them. So it's amazing to see such technology being used in this format to save a life. So thank you for this edition of the Tech Corner, and I hope that you enjoyed, and don't forget to pass on the information in the resources that's listed at the end of the video, as well that's under the webcast description. Welcome to the public health event for the 4th episode of the Public Health Link. So far what I've been doing is doing one public health event. And if you remember the very first episode, I said there's a possibility I might add on depending on what's happening, because there's always lots of events that are happening. Well, because of the couple public health concerns that are occurring here about the same time, I decided I would add on a second event for tonight. So I'm going to discuss the Binational Health Week that's in Santa Clara County, California. And I'm going to talk about locating a vaccine clinic near you that's for COVID, flu, and monkeypox. So first, I'm going to talk about the Binational Health Week in Santa Clara County. So when this started off as a week-long fair in Santa Clara County in California, and it's since has turned into a month-long event. So there's this through the networks of local, state, federal agencies, along with 50 consulates. And thanks to the special leadership of Secretariats of Health and Foreign Affairs of Mexico, in conjunction with the Health Initiatives of the Americas at UC Berkeley, and the Secretariats of Foreign Affairs of Guatemala, Honduras, Colombia, Ecuador, Peru, and several other Latin American consulates, they've been able to put this now month-long event together with tons of events throughout the month. I mean, this is a pretty spectacular public health fair that I was incredibly impressed when I found it. So what this is able is that this year's theme is to conduct a series of health promotion and health education activities to raise awareness and respond to unique healthcare challenges. This year's focus is on reconnecting to your health, which of course during COVID, it's been challenging. It's been challenging to have the regular recommended screenings and exams that we typically would do to keep ourselves in check, to know if there's something happening in advance. So now we're seeing through this public health fair that reconnecting to your health. So this year's focus includes free health exams, screenings, preventive care, COVID vaccines, flu vaccines, health information on mental health, nutrition and managing stress, as well as recovery and resources. Now, I want to give you an idea of how big this event is. As I said, it's grown from being 1 week to 1 month. There's a lot. I'm going to show you the calendar in just a moment of how many events are happening. And I'm hoping if you don't live in California and you know that someone does, post it, talk about it. If you have social media, if you have Facebook, Twitter, any of the social media accounts, post it, because you never know who could hear about this, that it could be beneficial to their health. So in 2021, they had 15 events that they hosted during the month. That resulted in reaching more than 32,000 individuals. It provided over 5,000 education materials. More than 560 health screenings were provided. Just shy of 500 COVID vaccines were administered, and more than 350 flu vaccines were administered. So this is a pretty big event, and the focus of it is for Latin Americans that are looking for ways to look at what can be done to benefit their health. Fantastic public health fair. And 2021's events included more than 370 volunteers, and I already named how it takes more than 50 consulates. I mean, this is a pretty big event that is fantastic cooperation between all the way the local municipalities into outside the country. Fantastic example of public health cooperation. And since the event's inception in 2005, right? That means more than 500,000 people have been reached. I was just incredibly impressed with this. I hope that you visit. Please share about this link so other people can find out about it and take part. This link provides fantastic information of what's happening during the week, who it's affected last year. But the part I really want to show you is this calendar here. There are a whole bunch of events that's happening that includes, like I said, health screening, but also some informational sessions as well. So if they click on them, it takes you to register to the event, but you can see how many events are happening for the month. So I'm really hoping that you will definitely share this information about the Binational Health Week in Santa Clara, California. So for my next event, so that's more, obviously that's for a particular region, of the United States. Now I want to talk a little bit more generalized. There's quite a few things happening. COVID has definitely not gone away. There's a brand new bivalent vaccine that's out, and hopefully, you're thinking about getting your next doses, or what's referred to as a booster, soon. I want to show you how to look that up. And hopefully you're thinking about your flu vaccine and following through with that. And if you're eligible or at risk, that you're also looking to see about getting a monkeypox vaccine. So I want to go through a couple of the websites to help you do that. Now, the only one I'm not showing you, and I want you to think about, are you up to date in your polio vaccine? Especially I'm mentioning New York because we know there's a concern there. There's been emergency declared. It's being seen in wastewater, and I actually covered that in a past episode too. Definitely take a look at the one of the first episodes where I talk about polio in New York. So for polio vaccines, reach out to your local health authority or local health department. If your doctor's office are keeping track of your vaccine records, and see what you need to do to make sure your polio vaccine is up to date, and how you can do that in your own community. So that you'd reach out again to your local health department or your doctor's office to do. So for the COVID, flu, and monkeypox vaccines, let's talk about how to look it up. And I do want to mention something. You don't want to get vaccinated if you're sick. If you're unsure if the symptoms you have are signs of illness, in other words, let's say it's like, well, I have allergies. It makes it very difficult for me to tell the difference between allergies and something else. Then I would definitely talk to your provider about doing a COVID test and speak to them about whether your normal is a sign of illness or not, okay, before you get a vaccine. In addition, if you're somebody that's been exposed to someone with COVID, okay, so if you know the person you've been around has been exposed to COVID, even if you do not have symptoms, do not get vaccinated until you're out of that monitoring period. So I just want to throw that in there too. Wait through that you're through it at a minimum of that 10-day monitoring period. Make sure you're symptom-free before you go in to get any kind of vaccines. So let's talk first about vaccines.gov. Now you can see at the top here, that I can choose either the COVID-19 vaccine or the swine flu. And as you can see, it's very easy. The website will walk you through everything you need to put in, and it's very brief to try to locate a local provider for a vaccine. This comes in handy, especially if you're in an area where there are many options and you're just trying to find the closest one to your home, or maybe you're in a rural area and you're not really sure where to go to. Fantastic either direction. So I would just put my zip code in here and I would choose which one of these that I'm thinking about. So again, the bivalent is the new vaccines that came out with the new variants. And if you're not sure which one to choose, if you're looking at it and you need some guidance, reach out to your local health department and or your healthcare provider and see what they recommend for which vaccine for you. And in addition, down here, you choose if it's a child. So in this case, I would check this if it was for a child that's between 6 months and 4 years. At the top here, that's for COVID vaccine. I could hit the next tab for flu, and again, I would put my zip code in and enter which type of flu vaccine I was looking for. Was I looking for one that's egg-free? Do I want the one that's the flu nasal spray? Did I want the high dose or adjuvanted vaccine for 65 plus? I would choose that. So vaccines.gov is a fantastic way for you to get an idea of where you can get a COVID or a flu vaccine. And if you're unsure which one, like I said, definitely reach out to your local health provider or your health department to guide you to which one works best for your circumstance. In addition, I also want to mention to you, if you're watching this and you're like, I'm really not tech savvy to be filling this out, I'm not comfortable, right up here at the top, right here at the top here, there's a number for me to call. If you're hearing impaired, there's also a TTY here too. So if you know somebody that you would like to recommend for them to locate for a vaccine and they're hearing impaired, there is a TTY number that you can provide that individual so they can seek out that information for themselves as well. So this 800 number here is the same, provide the same information as if I entered it here, but I can give somebody orally the information and they'll tell me verbally, and they'll tell me where I can locate a vaccine administration site. So I also want to mention for the monkeypox vaccine. So just like what we just seen here for flu and COVID, there's a map that will help me locate where I can get a vaccine in the United States. And I had it enlarged to show you that in this map, it also covers Puerto Rico, Hawaii, and Alaska. So even if you're not in the continental U.S., this is still useful. If you know somebody that's in any of those other locations that needs to know where they can get a monkeypox vaccine, please send them this link so they're able to do that. If you're unsure if you're someone that needs to have one, if you're unsure if the risk that your particular risk would need a monkeypox vaccine, again, please reach out to your public health professional at your local health department or your care provider so that they can walk you through whether or not this is something that you need to do, that you need to be vaccinated for. Now, again, this is the broad map to show. However, I can also click and put my zip code in. So I can put my zip code in here. It'll take and show me what options are available. So I'm going to put this zip code in here, and it'll show me what options are available where I live. Okay, so this is in Oakland County, downstate. This is in Michigan, downstate Michigan, and it'll actually show me where the locations are at so that I can reach out to those places. So here I've got a web address, a phone number, even an email address, and their hours of where to get that information. So the whole point of the public health link is that this is information that's actionable. I am hoping that you not only take the information I'm giving you, because these are such small blurbs, right, of really what's available, but look up the links in the end of the video or that's listed in the webcast description so you can apply it. That is really the point of all this. And that hopefully you share. Again, you have social media, share it so that other people can see where they can get this information from, where they can get vaccines, or in this case too, let's not forget that fantastic month-long public health fair, the Binational Health Week that's in Santa Clara County, California. Thank you for joining me for tonight's public health event. Hello and welcome to the 4th episode of the Public Health Meter. I'm excited about information I'm presenting tonight because it's looking at an official document from the Surgeon General and how to put it into action. And this is something I think we all need to do, especially it's not even just with social media, but it's even when we're talking to each other, and how we encourage people to look up information. So this was an official report that was actually published last year in 2021 about how to combat or confront health misinformation. And this is really something we all can do. And it's not always going to be a situation where, we go gun-ho after maybe something we know isn't accurate, but it could be as simple as showing by action. In other words, maybe what you're saying, what you're posting, where you're getting your information from, because I can tell you that is contagious. If I'm posting information or I'm talking about with others, places where I'm getting like what I'm doing on this, that's a ripple effect. So we need to think about doing it and taking it into every part of our lives, even if it's at home, at work, at school, of course, that we're encouraging others to go that extra mile too. This document is 22 pages long. And what I really like about it is, let me go down here to the table of contents. It covers everybody. It covers information like how to, how to use this information at home, how to use it at work, how to use it at school. If you're in the media, how can you apply the recommendations from this document? If you have a technology firm, what can you do with this? All these different angles of how to contribute, because we are all a piece of the puzzle. Like I said, even if it's what we're verbally saying to each other, we help to reinforce either solid information or only opinion. And the only opinion part, especially when it's based on something that's not factual or a really good solid foundation, can be dangerous, especially when it comes to recommending like public health recommendations or providing public health recommendations, or, where to go for health input, excuse me. So what I want to focus on first, I'm going to go down to page 8. And this is what individuals, families, and communities can do. So they talk about really 3 points here. Learn how to identify and avoid sharing health misinformation. Engage with your friends and family on the problem of health misinformation, and address health misinformation in your community. So this is really why I find it so important that the information I'm providing to you, you can look it up for yourself. So when you're looking at information and you're trying to determine, is this a good source? Here's a couple of things to keep in mind. Is there a bias? Like, is there some way that they can financially benefit, or maybe their job can benefit, or, is there some sort of obvious bias that could be part of it? Is their opinion rooted in some fact? Okay. Can I easily find it? When I find a website and it has this information in it and I can't find where they receive their information, then I'm going to question it. Because I should be able to find where they receive their information from. I should be able to find it relatively easily. Another way is look for dates. On the bottom of pages, most, especially if it's science-based, will tell you when it was reviewed or when it was updated or when something was created. If the date, let's say it's talking about the SARS virus, but it's referencing from 2009, then it's not going to be for COVID-19 or SARS-CoV-2, right? It's going to be for previous SARS viruses, which would not have the same information in regards to, for instance, whether vaccinations are available or whether or not what we can do to prevent the spread among each other. So checking for dates is incredibly important. Encourage people around you to do the same thing. Social media is a really big way to make sure that if you're not sure about something, if you really are looking at it and going, I don't know, maybe this is too good to be true, or I'm questioning the legitimacy of something, then err on the side of caution and don't post it. There are times that when I'm scrolling through my news feed that I come across something and I'm like, I'm not really sure about this. I don't have time to research it right now. I'll look into it later. So I just don't post it. I don't post it until I have an opportunity to look at it and see, is this something that I can vet, for lack of a better way of saying it. Okay, now I'm going to go down to page, and as I'm scrolling, hopefully you're seeing how there's things in here for education institutions, health professions, and I'm going to go down here to page 16 of this document. Where do we go from here? And it says, I just want to read the very last portion of this. We have the power to shape our information environment, but we must use the power together. Only then can we work towards a healthier information environment, one that empowers us to build a healthier, kinder, and more connected world. I was just thought that summarizes everything. And it's not just with this document. That is the essence of the public health link. Our information environment. I thought that was an absolutely perfect statement. This document speaks throughout the whole length of it, action. It's not something that you're going to use only for information purposes. It's going to be something that, it really makes me think about how can I apply it? What can I do so that I don't accidentally put something out there that turns out isn't accurate, and it could harm somebody else. So after having gone through this document, I looked at the references. It came out in 2021, so it's pretty updated for the subject matter it's speaking of. There's nothing that's changed in a year that's going to talk about misinformation that's going to make this document inaccurate, okay? I really liked how it covered it for multiple outlets. It's not just saying to any one person, hey, this falls on you. It's saying to everybody, we all have a stake in the information that's provided, so let's all do what we can so the information put out there benefits us all. It's definitely a communal way of making sure that information is as accurate as possible. So for that matter, on the pH meter, and remember the pH meter, if it's very acidic, that means it's encouraging you to do absolutely nothing. If it's high on the alkaline scale for the public health meter or pH meter, so if it's high on a 10, that means like I'm rearing to go and I'm going to put this information in and I've got everything mapped out for me. If it's neutral, it's a 7, that means it's like, okay, it's just information. Well, for this particular 4th episode of the Public Health Link, for this pH meter, I actually put tonight's at an 8. Okay, so why did I say 8? Why did I say just 1 above information? Well, the only thing that I would have liked a little bit more about this document is it gave just a few more examples of action examples. You and I can talk about it. You and I talked about social media, and we're discussing about ways that we can apply this to everyday life, even in conversations that we're having with our neighbor, our friends, our coworkers. But I felt like I would have liked a few more examples. I really like, though, how it broke it down by things like our profession. That we can go and say, well, I work for healthcare. Let me see what it says about health professionals. I really liked how it said that. And because it broke it down by where we may spend our time, that's why I gave it an 8. And that's why it was 1 step above information, because this is a good foundation to really think about places that we could accidentally spread misinformation and what we could do to make sure it's as accurate as possible. So thank you for joining me on this 4th episode of the Public Health Meter. On this 4th episode of the Public Health Link, we covered a heck of a lot of information. We talked about how to return home as safe as possible after the devastation caused by Hurricane Ian. We discussed where to look up information regarding current outbreaks of foodborne diseases. And we talked about street drugs, specifically fentanyl, looking awfully similar to candy. For our Tech Corner, we discussed the use of a 3D printer to help researchers look at ways to battle infant kidney diseases. For our upcoming public health event, we covered not 1, but 2 events. The Binational Health Week, which is actually 1 month long in Santa Clara County, California. And we talked about some websites that can help you locate vaccine providers for COVID, flu, and monkeypox vaccines. And for our pH meter, we talked about the Surgeon General's report about confronting health misinformation. So the entire point of the Public Health Link is to provide you with information and resources so that you can help enable, as best as you possibly can, good health for your household, your family, your workplaces, the schools that you're in, as much as absolutely possible. So you can put that information into action. The value of knowledge increases the more that we can use it and reproduce it. Don't forget that to hit subscribe so that you can be alerted on our next episode and release of the next episode of the Public Health Link on Sunday, and of any special reports that could come out during the week as well. If you have any ideas for either a public health episode or for any public health events, you can email thepublichealthlink@gmail.com. Again, thepublichealthlink@gmail.com. So I have one question left for you at the end of this 4th episode. That question is, how can you contribute to the health of your community? This is Marisa Salisbury signing off for this 4th episode of the Public Health Link on October 2nd, 2022. And I look forward to seeing you next weekend on the Public Health Link. Have a wonderful week.